Now to review the previous lesson, I'd like you to watch a video clip about the cardiovascular system to have an overview of this organ system.
The cardiovascular system is part of the circulatory system that circulates blood. The circulatory system also includes the lymphatic system, which circulates lymph, but the terms circulatory system and cardiovascular system are commonly used interchangeably to describe blood circulation. The cardiovascular system consists of the heart, blood, and blood vessels. The heart is essentially a pump that moves blood through the vessels. It has two sides, each of which has two chambers. The best-known function of the circulatory system is perhaps the transport of inhaled oxygen from the lungs to body's tissues and removal of carbon dioxide in the opposite direction to be exhaled. Basically, oxygen-poor blood from the body returns to the right side of the heart, where it is pumped to the lungs. In the lungs, blood picks up oxygen and releases carbon dioxide. Oxygen-rich blood then returns to the left side of the heart. This part of the system is called the pulmonary circuit. The left side of the heart pumps oxygen-rich blood to body's tissues, where it unloads oxygen and picks up carbon dioxide. The resulting deoxygenated blood again returns to the heart's right side to complete the cycle. This part is the systemic circuit. Because the heart's left side has to pump blood to the entire body, it has much thicker muscle than the right side. There are 4 valves which serve to ensure one-way blood flow through the heart. Oxygen-poor blood flows from right atrium to right ventricle to pulmonary arteries, while oxygen-rich blood moves from left atrium to left ventricle to the aorta. The heart is enclosed in a double-walled protective sac called the pericardium. The pericardial cavity contains a fluid which serves as lubricant and allows the heart to contract and relax with minimum friction. The heart wall has 3 layers. The outer layer, epicardium, lines the pericardial cavity. The inner layer, endocardium, lines heart chambers and valves and is continuous with the endothelium of blood vessels. And the thick middle layer, myocardium, is the muscle tissue responsible for the beating of the heart. The contraction of the heart muscle is initiated by electrical impulses, known as action potentials. Unlike skeletal muscles, which have to be stimulated by the nervous system, the heart generates its own electrical stimulation. The impulses start from a small group of cells called the pacemaker cells, which constitute the cardiac conduction system. The primary pacemaker is the SA node. It initiates all heartbeats and controls heart rate. Apart from transporting gases, the blood also supplies body's tissues with nutrients and removes metabolic wastes. It receives nutrients from the digestive system, where digested substances are absorbed through the walls of the small intestine into the bloodstream. These substances are then passed through the liver to be screened for toxins before joining the general circulation. In tissues, nutrients are exchanged for wastes. Wastes are then filtered from the blood in the kidneys and removed in urine. The blood also carries hormones from endocrine glands to target organs and plays an important role in the body's immune defense. The blood has 2 main components, a clear extracellular fluid called plasma, and the so-called formed elements which include red blood cells, white blood cells, and platelets. Red blood cells transport oxygen and carbon dioxide. White blood cells participate in various defense mechanisms against invading organisms, while the platelets are responsible for blood clotting minimizing blood loss during an injury. The blood circulatory system is a closed loop, meaning the blood itself never leaves the vessels. Instead, substances diffuse through the walls of blood vessels to move to and from the surrounding tissues. Vessels that move blood away from the heart are called arteries, while those that bring blood back to the heart are veins. Arteries usually carry oxygenated blood, while veins carry deoxygenated blood. For pulmonary arteries and veins, however, the reverse is true. The usual route of blood flow is heart to large arteries, smaller arteries, then even smaller arteries, called arterioles, then smallest blood vessels called capillaries, where the exchange of substances takes place. Blood then collects into small veins, called venules, then to larger veins, and back to the heart. Arteries and veins essentially serve to conduct blood. Their walls consist of 3 layers. An outer layer of loose connective tissue serves to anchor the vessels to the surroundings. A middle layer of mostly smooth muscles allows the vessels to constrict or dilate, regulating blood flow. And an inner layer consisted of thin squamous endothelium separated from outer layers by a basement membrane. In general, larger vessels have more connective tissue and smooth muscle. In addition, arteries have more muscles than veins because they carry blood away from the heart and must withstand higher pressures generated by the beating of the heart. The walls of capillaries, whose function is to exchange substances between the blood and surrounding tissue, consist solely of a thin endothelium with its basement membrane, thus permitting easy diffusion of blood solutes.
Okay, now let's review some of the main ideas of this session. So the cardiovascular system consists of the heart, blood, and blood vessels, including the aorta, the largest arteries of the body, and vena cava, the largest vein, and capillaries. arteries, arterioles, vein, and venules are smaller blood vessels transporting oxygen and carbon dioxide to and from the heart. Some of the key terms in terms of the blood: polyoxygenated blood, blood high in or rich in carbon dioxide, or deoxygenated blood. Oxygenated blood or blood high in or rich in oxygen. The heart has 4 chambers, 2 atria and 2 ventricles. And it also has the valves have to preventing the backflow of the blood. Make sure that the blood moves in one direction. For heart valves are the AV valves and similar valves. Gyroscopic valve and biscopic or mitral valves are the AV valves. Aortic, semilunar valves or pulmonary semilunar valves. The atrium, the singular, or the atrias of the heart. They are small and thin-walled chambers, receiving blood from the vena cava and pushing the blood into the adjacent ventricles. The ventricles make up most of the mass of the heart, and it has a role of discharge chambers of the heart, pushing blood into the pulmonary arteries and aorta. Four valves of the heart, including the AV valves and semilunar valves. The four heart valves prevent the backflow of the blood, measure the blood that moves in just one direction. Let's have a look at the path of blood through the heart. Some other medical terms involve the cardiovascular system, blood pressure, a measurement of pressure exerted by blood on the walls of blood vessels. The upper number of the blood pressures indicate the systolic pressure, which means the ventricles are contracted, and the lower number shows the diastolic pressure, whether the ventricles are relaxing. The two conditions involve the blood pressure is hypertension, means high blood pressure, and hypotension, low blood pressure. But make sure that you know the difference between the heart rate and the pulse rate. A severe cardiac problem is congestive heart failure. And the graph shows how the angina pectoris or chest pains occur, leading to the heart is quickened. A blockage in the coronary arteries causes the angina pectoris or chest pain. The heart muscle died because of the lack of nutrients. And leading to the quickening of the heart. The pain moving or radiating down left arm may signal a heart attack or MI, myocardial infarction. In session 3, discuss more about the types of heart failures. With the right heart failure and the left heart failures, accompanied by varieties of symptoms. There's some tasks for you to review the lesson. Task 1. Get ready. Using the words in the box to fill in the blank. Task 2. MCQ questions. That's 3 synonyms. That's 4 MCQs. That's 5 error recognition. That's it. Go stats. MCQs for the passage. And the last one, task 7. Write more than 2 words for each blank. Take 15 minutes to complete the task. Write your answers in a link given. Anh chị làm bài trên đường link của cho câu hỏi 15 phút. Just one yet. After. That's three synonyms. Passport. Yeah, that's fine. Covering the mistakes. Acids. Just 7. Now, let's study the new chapter, chapter 10, the respiratory system. And today we talk about section 1, anatomy and physiology of this organ system. Okay, section 1. Now look at the vocabulary of this section. Respiratory system or respiratory systems. The system responsible for breathing and gas exchange. hô hấp và trao đổi khí. Supply the oxygen and remove carbon dioxide. Cardiovascular system, we just already learned in the previous lesson. The lungs, nose, pharynx, larynx. The main structures of the respiratory system. Pharynx or throat, larynx or voice box, and trachea in windpipe. Bronchi. Two main branches extending from the trachea into the lungs. Bronchioles. Smaller branches of the bronchi inside the lungs. Respiratory tract consists of the upper respiratory tract and lower respiratory tract. The upper portion include the nose and pharynx, whereas the lower portion consists of the trachea and the lungs. Box or larynx, body tissues, bloodstreams, veins, circulatory system, oxygen, carbon dioxide, respiration, or breathing, inhalation, breathing air into the lungs, and exhalation, means expelling air from the lungs. So inhalation means breathing in, and exhalation means breathing out. Respiratory cycle in the complete process of inhalation and exhalation. A cellular respiration, the process that produces energy in cells. Oxygenated blood, acid-base balance, energy producing function. Transport, verb and noun, or transportation, the movement of substances. A transport of air, transport of gases, transport of nutrients. Regulate, regulation. Harmful accumulation, accumulation. Or the buildup of substances in the body. Disease-causing microorganisms. Viruses, bacteria are disease-causing microorganisms, are capable of causing the disease. Lethal substances. Dangerous or toxic substances that may cause death. Interruption. Failure of body systems. Heart failure, kidney failure, mean the loss of normal function of the body system or organ. Irreparable damage, mean the permanent injury that cannot be repaired. Delivering oxygen, or carrying oxygen, or distributing oxygen to tissues and organs. And waste products, now removing the waste products or toxins. Cellular activities. Processes occurring within the cells. Breath out. Facilitate. To make it easier or more effective to do something. Facilitate. Gas the body means protects the body against something. Smell detecting cells means the cells responsible for detecting odors. Speech cells. Byproduct. A secondary product formed during the process. Okay, now listen and practice saying the sounds correctly. Pay attention to the pronunciation of the vocabularies.
Chapter 10. Respiratory System Vocabulary. 1. Respiratory System. 2. Cardiovascular System. 3. Lungs. 4. Nose. 5. Pharynx. 6. Larynx. 7. Trachea. 8. Windpipe. 9. Bronchi. 10. Bronchioles. 11. Respiratory tract. 12. Upper respiratory tract. 13. Lower respiratory tract. 14. Voice box. 15. Body tissues. 16. Bloodstream. 17. Veins. 18. Circulatory system. 19. Oxygen. 20. Carbon dioxide. 21. Respiration. 22. Inhalation. 23. Exhalation. 24. Respiratory cycle. 25. Cellular respiration. 26. Oxygenated blood. 27. Acid-base balance. 28. Energy-producing function. 29. Transport. 30. Regulation. 31. Harmful accumulation. 32. Disease-causing microorganisms. 33. Lethal substances. 34. Interruption. 35. Failure of body systems. 36. Irreparable damage. 37. Delivering oxygen. 38. Waste product. 39. Cellular activities. 40. Breath out. 41. Facilitate. 42. Guards the body. 43. Smell detecting cells. 44. Speech sounds. 45. Byproduct. Chapter 10. Respiratory System Vocabulary. 1. Respiratory System. 2. cardiovascular system. 3. Lungs. 4. Nose. 5. Pharynx. 6. Larynx. 7. Trachea. 8. Windpipe. 9. Bronchi. 10. Bronchioles. 11. Respiratory tract. 12. Upper respiratory tract. 13. Lower respiratory tract. 14. Voice box. 15. Body tissues. 16. Bloodstream. 17. Veins. 18. Circulatory system. 19. Oxygen. 20. Carbon dioxide. 21. Respiration. 22. Inhalation. 23. Exhalation. 24. Respiratory cycle. 25. Cellular respiration. 26. Oxygenated blood. 27. Acid-base balance. 28. Energy-producing function. 29. Transport. 30. Regulation. 31. Harmful accumulation. 32. Disease-causing microorganisms. 33. Lethal substances. 34. Interruption. 35. Failure of body systems. 36. Irreparable damage. 37. Delivering oxygen. 38. Waste product. 39. Cellular activities. 40. Breath out. 41. Facilitate. 42. Guards the body. 43. Smell detecting cells. 44. Speech sounds. 45. Byproduct.
Okay, now look at the reading passage. Read the passage. Listen to the recording. Highlight the vocabularies and summarize the key ideas from the reading passage in the textbook.
Chapter 10. The Respiratory System. Section 1. Anatomy and Physiology. The respiratory system is made up of organs that are responsible for delivering oxygen to the cardiovascular system that transport it to the body. Cells. Oxygen is an important element for cells, the vital substance used to provide the energy which is required for cellular activities. In addition to this vital task, the respiratory system helps remove carbon dioxide, thus preventing the harmful accumulation of this waste product in body tissues. The respiratory system functions its vital activities uninterrupted, which is necessary for life. A short interruption, even for a few minutes, of its vital tasks can cause an irreparable damage to body tissues. This damage results in the failure of all body systems and ultimately death. There are many important functions of the respiratory system along with its basic functions of inhaling oxygen and exhaling carbon dioxide. It aids in regulation the balance of acid and base in the body tissues, an activity that is critical for the normal function of the body tissues. This system guards the body against disease-causing microorganisms and lethal substances that entered in the body during inhalation. Smell-detecting cells are also housed in the respiratory system and help in the production of speech sounds. The respiratory system works with the cardiovascular system to exhale carbon dioxide and provide oxygen to the body cells. This two-phase process is called respiration. Inhalation is the first phase of respiration in which air is breathed into the lungs. Oxygen present in the air is transported to the heart through the veins. The heart pumps the oxygenated blood to the whole body. The first phase of respiration completes when the oxygen is transported to the cells from the bloodstream. Cellular respiration, an independent energy-producing function, consumes this oxygen, and this process produces a byproduct carbon dioxide. The completion of the first phase initiates the second phase of respiration, and carbon dioxide moves to the bloodstream from the body cells. Carbon dioxide-laden blood moves to the heart, which pumps this waste product into the lungs. The process of exhalation cleans the blood by removing carbon dioxide. The respiratory cycle completes with this breath out. The respiratory system is comprised of the organs that start from the nose and end at the lungs. These organs constitute lower respiratory tract, the larynx or voice box, and the trachea, and the upper respiratory tract. The nose and the pharynx or throat. The trachea is also called the windpipe, which further splits into two branches which are known as bronchi. And a pair of sac-like spongy organs called lungs. Bronchi are divided into tiny branches called bronchioles. Different organs of the respiratory system like nose, pharynx, larynx, trachea. Bronchi and bronchioles play their role to facilitate inhalation and exhalation process. The lungs are the most important organs of the respiratory system, which work with the circulatory system to provide oxygen to the body and cleanse the body of the byproduct carbon dioxide.
Okay, a few minutes to read the passage again and highlight the key ideas or the main ideas of the whole text. Okay, another video clip about the respiratory system to have an overview of this body system. The anatomy and physiology of this body system.
The major function of the respiratory system is to exchange oxygen and carbon dioxide between the body and the environment. The gas exchange process itself takes place in the respiratory division within the lungs. The rest of the respiratory tract, the nose, pharynx, larynx, trachea, bronchi, and bronchioles, essentially serve as passageways for air to flow in and out of the lungs and constitute the conducting division. The nasal cavity is lined with a ciliated mucous membrane. The sticky mucus traps inhaled particles, while the beating of cilia drives debris-laden mucus toward the throat to be swallowed. Inhaled bacteria are destroyed by lysozyme in the mucus. Additional protection against potential pathogens is provided by lymphocytes and antibodies. There are 3 folds of tissue arising from the wall of the nasal cavity, called nasal conchae or turbinates. These structures serve to increase the contact surface with inhaled air, enabling the nose to rapidly warm, moisten, and cleanse it. The roof of the nasal cavity has olfactory nerve cells in its lining and is responsible for the sense of smell. From the nose, inhaled air turns 90 degrees downward as it reaches the pharynx. This turn is another trap for large dust particles, which, because of their inertia, crash into the posterior wall of the throat and stick to the mucosa. The pharynx houses several tonsils. These immunocompetent tissues of the immune system are well positioned to respond to inhaled pathogens. In addition to inhaled air, which is on its way to the lungs, the pharynx also passes food and drink from the mouth to the esophagus. Because aspiration of food or drink into the lungs may potentially be life-threatening, there are mechanisms in place to prevent this from happening. The larynx is most critical in this regard. The opening of the larynx is guarded by a tissue flap called the epiglottis. During swallowing, the larynx is pulled up and the epiglottis flips over, directing food and drink to the esophagus. More importantly, the vocal folds also close to protect the airway. From the larynx, air passes to the trachea, the windpipe, which then splits into 2 primary bronchi, supplying the 2 lungs. In the lungs, primary bronchi branch into smaller and smaller bronchi and bronchioles, forming the bronchial tree with millions of air tubes or airways. The airways have a layer of smooth muscle in their wall, which enables them to constrict or dilate. In response to the body's higher demand for air, such as during exercise, the airways dilate to increase airflow. On the other hand, in the presence of pollutants in the air, the airways constrict to minimize their entry to the lungs. The larynx, trachea, and bronchial tree are lined with ciliated columnar epithelium, which produces mucus and functions as a mucociliary escalator. The mucus traps inhaled particles, while the cilia beating moves the mucus up toward the throat, where it is swallowed. The last component of the conducting division, the terminal bronchioles, branch into several respiratory bronchioles, which mark the beginning of the respiratory division. The respiratory bronchioles end with microscopic air sacs called the alveoli, each of which is surrounded by blood capillaries. This is where the gas exchange process takes place. The alveolar wall is composed mainly of type 1 thin squamous cells, which allow rapid gas diffusion. Inhaled oxygen moves from the alveoli into the blood in the capillaries, while carbon dioxide relocates from the blood to the alveoli to be exhaled out of the body. There is also a small number of type 2 cuboidal cells secreting a surfactant, whose function is to lower the surface tension at the air-liquid interface and prevent the alveolus from collapsing at the end of each exhalation. The alveoli also house a large number of macrophages, ready to engulf any inhaled particles that manage to get past previous barriers to the lungs. The debris-laden macrophages then ride the mucociliary escalator up to the throat to be swallowed and digested.
how the respiratory system functions, its structure, and its role in maintaining life. Trong section 1 thì nó chủ yếu nói về cái cấu trúc, cơ quan trên bề dạng khoa học và vai trò, cơ chế hoạt động của nó trong việc duy trì sự sống. The main function delivers oxygen to the cardiovascular system, removes carbon dioxide from the body, cung cấp oxy và loại bỏ CO2, essential for cellular energy production and survival, rất cần thiết cho quá trình tạo năng lượng tế bào và sự sống còn. Even a sharp disruption can cause tissue damage, failure of the body systems, and death. Chỉ cần có gián đoạn hô hấp trong một thời gian ngắn thôi thì cũng có thể gây ra tổn thương mô, suy các cơ quan, suy trong cơ thể và dẫn đến tử vong. Đó là cái tầm quan trọng của sự sống còn. Một số những chức năng khác regulates acid-base balance in tissues, protects against disease causing microorganisms and harmful substances, and contains smell detecting cells, supports speech production. Ngoài chức năng chính là cung cấp oxy và loại bỏ CO2 thì nó còn có những chức năng khác như là điều hòa, cân bằng axit bazơ trong mô, bảo vệ cơ thể khỏi các vi sinh vật gây bệnh hoặc là những cái chất độc hại. Nó chứa những cái tế bào cảm nhận mùi và hỗ trợ cái quá trình tạo ra giọng nói. Respiration process involves the inhalation and exhalation, breathing in and breathing out. Inhalation, air enters lungs, oxygen moves to the bloodstream, then to the heart and body cells. And exhalation, when carbon dioxide returns to the lungs via bloodstream and is expelled. Quá trình hô hấp gồm có hít vào và thở ra. Khi hít vào thì không khí đi vào phổi, oxy thì di chuyển vào dòng máu, sau đó tới tim, tới các tế bào cơ thể. Thở ra thì CO2 quay lại phổi, thông qua máu và được thải ra ngoài. Cellular respiration, in which the cells use oxygen, producing carbon dioxide as a waste product. Trong hô hấp tế bào thì tế bào nó sẽ dùng oxy và tạo ra CO2 như một chất thải. The main components of the system: upper respiratory tract, include the nose and pharynx or throat, and lower respiratory tract, contain the larynx, trachea, bronchi, bronchioles, and lungs. Về cấu trúc của nó thì có hai phần chính, đường hô hấp trên và đường hô hấp dưới. The lungs are the central to the system, work closely with the circulatory system to exchange gases. Và vai trò của phổi là cơ quan trung tâm của hệ hô hấp, để phối hợp chặt chẽ với hệ tuần hoàn để mà trao đổi khí. Okay, now let's check the answers for the task. Task 1. Task 2. Task 3. Task 4. Task 5. Access. That's 7. Okay, another short clip to review the lesson today.
The invisible engine that lets you live, think, and move. And today, I'm going to explain it in a way so clear, you'll never forget it. The respiratory system has two major sections. One, upper airways, nose, pharynx, larynx. Two lower airways, trachea, broncha, bronchioles, alveoli. Memory trick. UL equals filters, lower exchanges. The upper airways perform three essential functions. Filter the air, cilia and mucus trap particles. Warm the air, humidify the air. The larynx protects the entrance to the lower airways with the epiglottis and allows phonation. When these structures become inflamed, as in upper respiratory infections, voice, breathing, and patient comfort all change. The trachea divides into the main bronchi, bronchioles, and finally the alveoli, the key players in gas exchange. An important anatomical detail. Each lung is divided into lobes. The right lung has 3, upper, middle, and lower, while the left lung has only 2, because it must make room for the heart. In the upper lobe of the left lung, we find the lingula. The lingula is not a true separate lobe, but a portion of the upper left lobe that functions similarly to the middle lobe of the right lung. It's a narrower, more angled area, which is why it is more prone to atelectasis, infections, or drainage issues. In some cases, it may show reduced volume, often due to previous infections, bronchiectasis, external compression, scarring. A reduced volume lingula ventilates poorly and is more prone to stasis and infections, so it should always be considered during respiratory assessment. The alveoli are small elastic sacs coated with surfactant, which prevents collapse and enables gas exchange. Memory trick: ALV equals air, liquid, vessels, to remember its connection with the pulmonary capillaries. Ventilation works through pressure changes. Inhalation, diaphragm contracts, negative pressure, air moves in. Exhalation, diaphragm relaxes, air moves out. Inside the alveoli, gas exchange occurs. O2 moves into the bloodstream. CO2 moves out. Memory trick: O2 goes where it's needed. CO2 goes where it can leave. Major signs that something isn't working: tachypnea, increased RR, respiratory distress. Use of accessory muscles, early warning sign. Wheezing, airway obstruction, crackles, fluid, pneumonia, edema, cyanosis, hypoxia, low SpO2, less than 95%, impaired gas exchange. In clinical practice, these signs guide respiratory assessment. Understanding the respiratory system helps you distinguish mild dyspnea from acute distress, recognize abnormal respiratory patterns, Kussmaul Cheney-Stokes, evaluate the effectiveness of oxygen therapy, interpret auscultation findings, wheezes, crackles, diminished breath sounds, monitor patients with asthma, COPD, and respiratory infections. It's one of the most essential skills for every nursing student. If you want simple diagrams, clear mental maps, and visual explanations for the entire respiratory system and its disorders, you'll find everything inside the Nursemate Pro digital guidebook. If this video helped you, hit like, subscribe, and turn on notifications. And remember, every breath your patient can take thanks to your assessment is because of you. You make the difference, future nurse hero.
Okay, a summary task for section 1. Write only one word for each blank for the summary message. Bye. 10 minutes to do the task and write answers in the chat box, please. Anh chị làm, ta cho đáp án vào trong hộp thoại ha. Okay, now let's check the answers. Okay, the last task for the lessons today. Scan the code and do the review task. Thirty minutes to finish the link. Make sure you submit the link before 4:30 p.m.